Hello everyone. Let us discuss about the COVID vaccine mandate called the Omnibus COVID-19 Healthcare Staff Vaccination Interim Final Rule under the Policy and Ethics in Public Health course. Introduction and overview. Ethically, healthcare workers have a duty to protect patients and others, and legal mandates are permissible. Vaccines safeguard the healthcare workers and the people they serve. COVID-19 vaccine mandates for healthcare workers sparked controversy. Vaccine hesitancy among healthcare workers poses a serious threat to the public. Implementation of these vaccine mandates for healthcare workers during COVID-19 in the US was a burden. COVID-19 vaccination mandates for healthcare workers are being considered as an ethical and legal obligation to protect the patients and public health. Legal challenges have arisen, but some states allow healthcare employees to mandate vaccines. The issues remain critical to ensure the safety of patients and the healthcare workforce. So let us see who are affected by these mandates and the outcome of these mandates. Healthcare workers, they are directly impacted as they are required to comply with these mandates. The extent of their impact depends on their vaccination status and personal views on mandates. Coming to patients, patients, particularly the vulnerable population such as the elderly, the children, and the immunocompromised individuals, are affected notably by the vaccine status of the healthcare workers. The pharmaceutical companies are indirectly involved as the public's trust in their products might be affected. The health outcomes. The healthcare workers, in case they are vaccinated, there are fewer chances of contracting the virus. In turn, fewer chances to get absent from the work due to illness, and hence the fewer chances to spread the virus. In turn, better chances to provide the possible health care. In the patients, the vaccination status of healthcare workers directly affect patient outcome. Certain associations like American Public Health Association, American College of Physicians, American Psychiatrists Association, American Pharmacology Association, and similar associations have made a joint statement in support of COVID-19 vaccine mandates for all workers in health and long-term care. This is the picture related to such statement. These are some of the existing policies of COVID mandates. The vaccination in the workplace guides, CDC and OSHA guidance, face mask policy template, social distancing policy template, health and safety protocols, infection prevention and control policy template, mitigation employer reopening liability checklist, employee temperature check and health screening questionnaire. But those existing policies are not much effective. They have certain weaknesses such as challenges of exemption, ethical concerns, potential workforce impact, the effectiveness of enforcement, and the legal challenges. And here is a video showing certain healthcare workers who are hesitant to take the vaccine and some others having the concerns about the COVID-19 vaccines. When we analyze these existing policies with ethical implications, it appears that they follow the principle of public health ethics and law to some extent, as they acknowledge the importance of informed consent. It also highlights the need for scientific accountability and transparency, which aligns with the principle of efficiency. But the analysis suggests that the potential violations of these ethical principles, including autonomy, justice, proportionality, beneficence, non-maleficence, health maximization, and efficiency. These violations stem from concerns about the impact and effectiveness of current vaccine policies. Omnibus COVID-19 vaccine mandate is the Centers for Medicaid and Medicare Services rule, effective since November 5, 2021, which mandates COVID-19 vaccination for healthcare providers and suppliers. Requirements: the covered facilities must establish a process to vaccinate the staff in two phases. Facilities must document vaccinations sincerely and securely. Exemptions are allowed for medical conditions or religious beliefs, but they must adhere to federal law. Enforcement and penalties are done through state survey agencies and accredited organizations. Non-compliance should result in civil monetary penalties, payment denials, or program termination. This mandate aims to protect healthcare workers and patients, but may exacerbate staffing shortages. Balancing the vaccine requirements with individual rights and accommodating exemptions presents challenging. Coming to the costs and burdens of this mandate, the federal administration evaluates the direct costs and health related benefits of the four largest US employer vaccination mandates. Based on some relevant analysis, the investigators concluded that the net benefits of the mandates depend heavily on the course of the pandemic, which may not be known in the beginning itself. Effectiveness of the mandate: the Omnibus COVID-19 vaccine mandate has proven effective in increasing the vaccination rates among the healthcare workers. The main reason is the safety of the COVID-19 vaccines supports their use in mandates, and the numerous healthcare organizations support this vaccination mandate in various sectors. The Supreme Court ruling. On January 13, 2022, the US Supreme Court issued significant rulings on COVID-19 vaccine mandates. In Biden versus Missouri case, the court allowed a ruling mandating COVID-19 vaccine for healthcare workers at federally funded facilities. These decisions highlight the balance between public health powers and individual liberties, with the court emphasizing on broad mandates should come from Congress or the states. The ruling have implications for pandemic policy and administrative agency authority. Now let us analyze this vaccine mandate using the moral foundations theory. The care or harm foundation. It aims to prevent the harm caused by the spread of COVID-19 within healthcare facilities, which can lead to severe illness and death. The fairness or cheating foundation. The CMS rule seeks to create a level playing field by requiring all eligible staff to either get vaccinated or provide valid exemptions. It also addresses concerns about staff members who may try to evade vaccination without valid reasons. Authority or Subversion Foundation. The CMS rule is issued by a government agency, the CMS. It is the Center for Medicare and Medicaid Services, which represents the authority of the government to regulate healthcare facilities. This foundation underscores the role of authority in setting public health standards. Continuing the analysis, the Loyalty and Betrayal Foundation. It discourages actions by staff that could betray the trust and loyalty expected within the healthcare community, such as refusing vaccination without valid reasons. The sanctity or degradation foundation. It indicates the importance of preserving the sanctity of healthcare environments by preventing the degradation caused by the spread of a potentially deadly virus. This mandate has a potential positive impact. The impact on public health. This protects vulnerable patients and ensures the continuity of essential healthcare services. The patient safety. The requirement for healthcare staff to be vaccinated can enhance the patient safety by reducing the risk of healthcare associated infections. Uniform and fairness. This EMS rule promotes fairness and ensures consistent standards of care. This mitigates potential disparities in vaccination rates and enhances equity. The legal clarity. This rule can reduce legal uncertainty and facilitate effective enforcement. The infection control. The emphasis on vaccination as a primary infection control measure aligns with scientific evidence. This approach may encourage healthcare facilities to adopt vaccination as a central strategy, reducing the need for extensive testing and other measures. In conclusion, public engagement, clear communication, and sensitivity to individual circumstances will be essential to maximize the positive impact while respecting ethical principles. The Omnibus COVID-19 vaccine mandate has effectively worked better than the previous mandates. It was later modified and finally in May 2023 it was eliminated because COVID-19 seemed to be contained to a major extent. These are the references from which I took help to create my presentation. Thank you for watching my presentation.